Hello friends, welcome to my YouTube channel. Today I would like to share about diabetes mellitus. What is diabetes mellitus? Coming to diabetes mellitus, I would like to describe its history, how it came into existence. Diabetes mellitus is a metabolic disorder. It is a group of metabolic disorder that is characterized by high or persistent blood glucose level. In dating back to ancient times, Egyptian called it as great emptying of urine because they noticed the most frequent symptom of polyuria and they observed it as great emptying of urine. Later came Apollonius. Apollonius, who was a Greek philosopher and physician, he coined the term diabetes. Diabetes means to pass through. Now, coming to this condition, I would like to talk about Indian physicians who described it as Madhu-Meh. Madhu-Meh means the thing that is attracting ants. So, sugar or glucose in urine is attracted by ants. So, physicians of India they called it as Madhu-Meh. Galen, one of the scientists, he described it as diarrhea of urine. They have used different terms to describe a single condition, so in different ways. So I am trying to say how did they described it as. John Rowley, one of the physician, he described mellitus and he wanted to differentiate from diabetes insipidus, so they called it as they John Rowley used the term mellitus. Now coming to two Canadian physicians, there were two Canadian physicians who isolated and purified the insulin in the year 1921. In this year, tuberculosis vaccine was also prepared in 1921. Now Thomas Willis, who was also one of the scientists, he added the term mellitus to diabetes, indicating the pass-through of urine is sweet in nature. So they described in different ways this condition. Now coming to the epidemiology, how many people are affected by this condition? 425 million people are affected by this condition globally. The International Diabetes Federation states that estimates of 4 million people deaths are directly or indirectly related to diabetes. Males have high propensity to diabetes because of increased insulin sensitivity. They are more obese, blood pressure is high in these patients, and in addition to this, dietary changes like they more depend on meat, red meat, so that can also be a risk factor for diabetes mellitus. Now, in the developing countries of the world, of continents of Asia and Africa, there is increased rate of diabetes mellitus. India is a third diabetic capital, and who states that this is an 8th leading cause of death. Now, coming to the year 2017 and 2045, in the year 2017 up to 2045, there will be increase in risk of diabetes by 48%. So these scientific figures and significant figures elaborates and they provide an information which is intact in nature that there is still existence of diabetes in our societies. Now coming to the pathogenesis of diabetes mellitus. The pathogenesis of diabetes mellitus is also very important in understanding this condition. Insulin, which is an hormone that is produced by beta cells of pancreas, which is basically a protein made up of amino acids, controls the glucose levels in blood. Normally, insulin binds to the insulin receptors and there will be uptake of glucose by skeletal muscles and adipose tissue. And as a result of it, there will be production of energy by the cells, and so we can work. So patients who are diabetics, they cannot work for a long time. There can be fatigue and general weakness as known from the mechanism. Now type 1 diabetes mellitus, it is known as insulin dependent diabetes mellitus. It is a childhood onset diabetes mellitus. It is known as juvenile diabetes. Now in type 1 diabetes mellitus, there is beta cells. The beta cells which are present in the tail of pancreas are mainly involved. These beta cells are destroyed by autoimmune responses like production of autoantibodies or immune response produced by T cells. Now when there is a destruction of beta cells in the tail of pancreas by these autoimmune responses, there will be low or absence production of insulin, and that will result in insulin deficiency. Now these people are also having inheritance of HLA genotypes. So there is a human leukocyte antigen which is inherited in these patients. So it is associated with a family history. So many family members can have type 1 DM because there is an inheritance of HLA genotypes. Now in these patients, if there is an inheritance of HLA genotypes, viral infections like any type of virus, it can be COVID-19 also, that can trigger an onset of type 1 diabetes mellitus. And these cases must be treated properly. And in addition to viral infection, diet is also responsible for triggering type 1 type of diabetes mellitus. But this is seen in very less population. It is seen in only 10% of cases. The concordance twins rate is 50%. So if there are identical twins, there is a 50% chance that they can have type 1 diabetes mellitus. Now type 1 diabetes mellitus, there is no preventive measure. Only insulin must be administered in severe cases, and pancreas transplant must be done if there is a failure of pancreas. Now coming to type 2 type of diabetes mellitus. Type 2 type of diabetes mellitus is associated with obesity, unhealthy diet, improper lifestyle changes, and increased blood pressure, decreased sensitivity of insulin. So these are mainly factors that are responsible for type 2 diabetes mellitus. Now these patients will have insulin resistance. Insulin resistance means there is a resistance to insulin by 2/3 of our body cells. They are not responding to insulin. As a result of not responding to insulin, there is a decreased upregulation of glucose by fats and muscle cells. There is decreased production of energy. Type 2 DM, it is also associated with chronic complications like diabetic retinopathy. In diabetic retinopathy, what happens? There is a damage to the retinal blood vessels, and there is formation of new blood vessels which are abnormal in nature, and that is leading to diabetic retinopathy that will result in initially blurred vision and finally into blindness. Now coming to cataract and glaucomas in these patients can increase the risk by many folds. Cataracts are nothing but the lens gets opacified. You cannot see through the lens will be involved. There will be increase in intraocular pressures within the eyes. So that type of conditions can also be seen in patients with diabetes mellitus. Now diabetic neuropathy. Diabetic neuropathy is a condition where peripheral nerves are damaged. So there can be a damage to a peripheral nerves of upper extremities and lower extremities that can result into diabetic neuropathy. The most common complication, chronic complication that is associated with these patients is diabetic neuropathy. Now after diabetic neuropathy, there is diabetic nephropathy. Now what happens in diabetic nephropathy? In diabetic nephropathy, the increased blood glucose level It moves to glomerular capillaries, it damages the glomerular capillaries, there will be more loss of protein in urine, leading to albuminuria, and ultimately it can lead to end-stage renal disease, leading to kidney failure. So in these patients, kidney transplants are recommended in later stages when there is an end-stage renal disease condition. Now coming to diabetic nephropathy. After diabetic nephropathy, coming to diabetic vasculopathy. Now in diabetic vasculopathy, what is happening? All kinds of blood vessels, medium sized and large sized blood vessels will be affected. For example, coronary arteries, which are medium sized blood vessels, they can be affected, and that can result into heart attacks. So patients with diabetes are prone to heart attacks very easily. Now there is a strong correlation between diabetes mellitus and cognitive deficits. Now cognitive deficit means there will be decreased awareness, increased delirium, delusions, all types of psychotic symptoms and psychotic conditions will be accompanied by it. Now I would like to talk about gestational type of diabetes. What is gestational diabetes mellitus? Gestational diabetes mellitus means there is an increase in the blood glucose level during the gestational period, and after delivery of the baby it would be normal. If this condition is treated, then the damage to the fetus is minimized. Now if there is an untreated GDM, which is gestational diabetes mellitus, that can result in decreased surfactant deficiency, and as a result of it there will be infant respiratory distress syndrome. There will be macrosomia, that is high birth weight. The baby would be more than 4 kgs of birth weight, and that can lead to shoulder dystocia during delivery. Shoulder dystocia means there can be a shoulder dislocation during delivery. Now C-sections are performed in these patients regularly because natural delivery is not feasible. Now coming to other types of diabetes mellitus, for example maturity onset diabetes of young. It is an autosomal dominant disorder or a mitochondrial inheritance where blood glucose levels are abnormal. But it is believed that insulin can control glucose levels in patients with MODY, that is mature onset of diabetes in young. Now after this, there are certain drugs that are responsible for causing diabetes mellitus. Drugs like statins and corticosteroids, that is glucocorticoids, can cause diabetes. And the main mechanism that is responsible for the drugs to cause diabetes is insulin resistance. Insulin resistance is seen in type 2 DM, and it is also seen in drug-induced diabetes mellitus. Now after coming through drugs, if there is a beta cell gene mutations, if there are mutations within the processing of insulin, in the production of insulin, if there is a mutation in the insulin receptors, then we can see hereditary forms of diabetes. If there is a extensive damage to pancreas like chronic pancreatitis or cystic fibrosis, then also there will be severe damage to pancreas leading to diabetes in these patients. Now, how can we diagnose diabetes mellitus? Diabetes mellitus can be diagnosed by assessing the blood glucose levels. If the blood glucose level in fasting state is above 7.1 millimole per liter or above 125 milligram per dl, then it is diagnosed as diabetes mellitus. If 2-hour postprandial glucose is above 11.1 millimole per liter or about 200 milligram per dl, then it is diagnosed as diabetes mellitus. There is one more index that is responsible, that is glycated hemoglobin. Glycated hemoglobin means that the hemoglobin, the glucose attaches to the hemoglobin within the blood vessels, and if the percentage is above 6.5%, or above 48 millimoles per liter, then it will result into, that indicates that the patient has severe diabetes. Now, in addition to this, how to manage type 1 and type 2 DM? Type 1 DM, there is no preventive measure and we can use pancreas transplant. In type 2 DM, we will use anti-diabetic medications in addition to lifestyle changes, healthy diets and stress releasing hormone, stress decreasing, and controlling of blood pressure and preventing patient from smoking. So in connection with healthy diet, the patients must be more dependent on whole grains and fibers. They must decrease consumption of saturated fats and trans fats. They must more depend on polyunsaturated and monounsaturated fats. Lifestyle changes, like they have to do regular exercise, physical activity is encouraged. And in 90% of cases of diabetes mellitus, through lifestyle modifications, we have seen that the glucose level comes within the normal range. Now, talking about anti-diabetic medications like metformin. Metformin is a drug which is used in type 2 cases. It is a first line of choice. Metformin will decrease the production of glucose by liver. Along with this, we can also use acarbose. Acarbose will decrease the absorption of glucose in intestine. In addition to this, we can use DPP-4 inhibitors, dipeptidyl transferase 4 inhibitors, that will inactivate incretins, that is GLP-1 and GIP. As a result of it, there will be more production of insulin and that will control glucose. SGL2 inhibitors, they will increase glucose production in urine. So these type of drugs are evidently given in patients with type 2 DM but not in type 1 patients. And it is believed that patients with type 2 DM who are obese, doing physical activities and taking these drugs, have brought down the glucose range within normal. Thiazolidinedione, this is one of the anti-diabetic drug for type 2 patients that is used, that will increase the sensitivity to insulin. So these drugs and modification lifestyles certainly help in patients with type 2 DM. And diabetes mellitus is more common in developing countries of the world. So we have to be very cautious and we have to be alert while we are understanding these conditions, because understanding the disease will help you to come out of the situation easily. I have discussed each and everything related to diabetes mellitus, from history to the management, and still research is going on for new drugs. I would bring more intuitive and informative videos. Please understand this video. Thanks for watching. So, namaskar.